Guru Nanak Trust Fund, a UK registered charity, was established in 1976 specifically to support the Guru Nanak Home for handicapped children in Ranchi, India. The term home was especially coined so that the handicapped children would not be frightened by the term hospital, and every attempt has been made to date to provide an atmosphere of home rather than hospital in this institution. The Guru Nanak Home itself was established in November 1969 with an initial donation of £1,000 from London. With humble beginnings in a rented bungalow with just 10 beds, the home quickly progressed to become a highly specialised centre of excellence in treating, surgically correcting and rehabilitating handicapped children. Some 25,000 children were treated here up to 1995, when further funds from the UK allowed the local trustees to purchase the land and build their own purpose-built hospital with its own operating theatre. Over 2,000 operations have already been performed in the hospital, and at present 3 to 4 operations are done every week. In the last few years, through donations and biannual functions, we have managed to send over £150,000 to Ranchi, enabling the trustees to expand this magnificent facility. The home now has 100 beds with its own operating theatre and laboratory, 2 physiotherapy and occupational therapy suites, accommodation for staff and patients' relatives, kitchen facilities for relatives, and a play area for the children. A donation of £6,000 from the Lions Club of Chipping Barnet enabled the opening of an X-ray department, and Lion President Dilip Mandalia and Lion Surinder Aujla visited the home in November 2002 to inaugurate this unit. This was their second visit to the home. They had earlier donated a similar amount for the establishment of a physiotherapy department. The Rotary Club of Leighton, through their president, Mrs. Satish Gupta, were responsible for a donation of £10,000 for all the equipment in this department. This is the physiotherapy department in action. Several trustees have now visited the home and have all been impressed with the quality of work and efficient running of the home. In 2003, our chairman Gurdeep Gujral CBE and then Vice Chairman Harbans Sethi made a private visit to the home in Ranchi. They were warmly received by the trustees of the Guru Nanak Home, led by Mr. Preetham Chopra, Chairman of Trustees. Orthopaedic surgeons Professor Pandey and Dr. Anil Pandey then took Mr. Gujral and Mr. Sethi on a tour of the wards and facilities. Mr. Gujral expressed his great satisfaction at the excellent facilities at the home and the type of high-quality work being done there. A child with gross foot deformities. One foot has been corrected by surgery, while the other is waiting to be corrected. A child with severe contractures being corrected with a locally devised traction apparatus. This 10-year-old child with neglected polio has been crawling since the age of 3. She had a bent and fixed left knee. After traction for several weeks, she has had her first operation 2 weeks ago. After one more operation on the feet, she will be able to walk.